between listening to my loved ones' stories as they approach their impending orthopedic surgery and hearing some of the patient critiques, I've tried to use that to guide how I'm going to approach each day and each patient. I think medicine has seen a schism between the doctor and the patient, where doctors are becoming kind of the machine that kind of chugs along with diagnostics and patients are kind of working separately. But I think there's still somewhere where that relationship can be cultivated for both sides, not only for the patient's best outcome, but for my own enjoyment of being a doctor. That's an important opportunity, not only for me to show them that I care, but make sure you understand why. And so I think patients want to be taught, patients want to be talked to like a person, not like a computer screen. And so when I'm trying to work through a patient's diagnosis or come up with a treatment plan, I try to factor in those past experiences